So our next speaker is Vasumathi Sriganesh. She'll be speaking on how medical librarians can promote information therapy. So Ms. Sriganesh has expertise in medical librarianship, medical information retrieval, organization and provision of medical information from published electronic sources. She's also the founder of QMed Knowledge Foundation. Thank you.
Good morning, everyone, and thanks for inviting me out here. In my 10 minutes, I think the biggest message that I want to give everyone is the need for us to have good trained medical librarians in the country. And I think listening to all the questions that Rajesh read out, I think this breed of professionals can really take care of most of the issues which have come up as questions from various members in the audience or maybe those who are watching the program online. Okay. I'm sure quite a few of you have this question, why do we need a medical librarian, especially when everything seems to be on the internet? So I'm going to address this bit. The typical thing that would happen is, let's say if you're searching Google for treatment of back pain, is advocacy of rest important or is it important to be active? So what is Google giving you? A huge number of results. The first few that you see seem to be extremely relevant, sure they are, and they also are from good resources, which is very important because anyone can put up information on the web. But go to a few more pages, what do you get? Knee pain facts. You could also get things like this, and you could get really lost. You browse, and you're not sure where you are. One of the questions that came was, which information should we take from which doctor's database? Forget a doctor's database. Even from the highest of studies, you could get to know that antibiotic A is better. 25 big studies will say that. 25 big studies will say antibiotic B is better. You're back to square one. So what next? Where does the role of a medical librarian come in? A lot of people I have interacted with do not know that a librarian goes through a proper university degree and that can go right up to a PhD. We do have another speaker who is a PhD in library sciences. And one of our major areas of training is information sciences. That's a specialty that has been unfortunately badly ignored. I mean, people are not even aware that these people have gone through training and it's not just something they pick up on the job. So what do we know? In any specialty, we know the right resources, how to search and locate information which could be on the net, it could even be offline. The reality is everything is not on the internet, or even through the internet you don't get access to everything that is there in the world. This was a question that came up, how much is too much or how much is too little to give? And I'm going to answer this in the next slide. Okay. These are 3 examples I've taken as my role as the first librarian of HELP, something which I enjoyed doing thoroughly while I was there. Okay. I've just taken 3 examples of how we tackled patients who came in. There was this young lady who came with her mother-in-law. She had just got pregnant, so her mother-in-law wanted her to know more about pregnancy. Now at that stage, if she had done a Google search, right on top she might have got, as Vandana Gupta mentioned, something terrible about, say, miscarriages or something. Is that what she needed? Certainly no. Whereas Help Library had a wonderful collection of videos, so we could give her one on what a new mother needs to know. That was exactly what she needed then. And it took us something like 2 minutes to give her that. Both of them watched it, enjoyed it, went back very satisfied. If she needed specific medical information later, she could have come back to us and we would have given her the right stuff then too. The second was a mother of an autistic child. She came in on a Saturday. We gave her pamphlets, chapters in magazines, chapters in books, and at the end of it, she was overwhelmed. She said, I came with an expectation of maybe 1 or 2 small things to read up. You've given me all the right stuff. And added to that, I had the pleasure of driving her back home because she was on the way. And I think she kept on and on raving about the place. She was very happy with what she got. The third is a complex medical situation, which is absence of one portion of the brain. The parent was a doctor, and he called and told us, my newborn son has this. I don't want medical information, I want anything else social. And this was all the beginning of the internet era, when people were not even sure what they could get. So I gave him information about a support group, which again, Ms. Vandana Gupta mentioned. He was so happy about it. This was an international one. He got in touch with them. They sent him a lot of information, and they requested him to be a support person in India and start a support group. So all these were quick solutions that we could give them, thanks to a well-catalogued library collection, thanks to what was available on the internet, combination of both. What are the sources medical librarians look at? You can classify sources in a million ways. I teach this kind of thing to medical students, faculty, doctors, everybody. A very simple classification I have is 3 types of resources. The first being whatever gives you background or factual information, which could be in print or could be online. And these are some of the examples. So some of these you'll find in physical libraries, some of them you'll find online, some of them you find both. And it is important not to expect that everything good is only online. It's always good to also browse a physical collection. The second type is research information, what has already been published and what is under research. So you have the journal databases which are published information, and this is where a librarian along with a doctor with an information prescription could search, get out the most focused ones and tell them. The third kind, which is more recent, is based on the fact that there's far too much published information. So there are experts who do research on publications and bring out analysis. One of the great resources is something called Cochrane Reviews. I'll show you in the next slide. Another very new resource is something called PubMed Health. I'll be showing you that as well. These give you analysis of research done over the last so many years. This is the Cochrane library. You could Google and reach there. And I've taken the same topic, back pain. Is rest better or being active better? So you see this title which says advice to rest in bed versus advice to stay active, etc. And there is something called a plain language summary, which is useful for patients directly or for doctors to tell patients about it. Rather than give the whole journal article, go through this and only share so much with the patient and tell them, if you want the whole article, I'll give you that as well. But this is what the patient needs. So it says it's taken from 10 randomized trials, which are large studies, and this is the result for low back pain, this is the result for sciatica. Okay? It's small paragraph, easy to explain. There's one more area in a Cochrane review, which is the statistical analysis of the results. It's put in a very simple graph. This is one of the outcomes, and it points that all these studies are on this side of the line, and it says that is favoring staying active. So this is a very simple way in which doctor can say, out of all the large studies, this is the current result. And these reviews are updated every 2-3 years. So if some very large study tomorrow shows that no, rest is better, the doctor can change the line of treatment and explain to the patient that 2 years back this was the result, now things have changed. There's another very new resource called PubMed Health, and if you see, they have specific areas for consumers, and there's something called executive summaries. They also have this area called understanding what is clinical effectiveness, what is research, etc. So rather than just Google and doing a whole lot of things, go to some focused resources, and right in the beginning, Rajesh Jain also showed us some. Those are all well-known resources, and these are where librarians can train people as to how much easier it is to go to well-known places, search exactly what you have to, interpret results, go back to the doctor. So, in a nutshell, we have this expertise, the knowledge, and working with doctors. What we do is, we believe that unless the doctors receive the information therapy, this is not going to work completely. So we work a lot with students and academicians, and that is how our contribution to this entire process, and we hope we'll work together for patient therapy in the long run. Thank you very much.